All right. Well, hello, everyone, and welcome to the 2021 virtual series on aging in rural Oregon. Rather than our traditional in-person event this year, the Oregon Office of Rural Health has hosted a series of virtual forum sessions on the third Thursday, of each month. This is our last session for 2021, and we do plan to be back in person in Seaside in 2022. I'd like to thank you for joining us today, and thank you to our partners, Central Oregon Health Council, the Older Adult Behavioral Health Initiative, and GOBI. Kate, next slide, please. Our speaker has no conflicts to disclose. Next slide. And before we get started, I'll orient you to this virtual platform. The audio has been muted and the video is turned off for all attendees. Select the ellipses to populate the chat and the Q&A features to your right. And we ask that you please ask session questions using the Q&A feature and use the chat function for everything else, including any technical difficulties that you experience. The presentation slides and recording will be posted shortly after the session on the Office of Rural Health's website at the link on the slide. And if you like CEU for this session, it's really important that you please complete the survey at the end of the session, and I'll post a link to the survey toward the end of the session. I will also send an email in the next couple of days, which will include the link to access the slides and the recording, as well as the session evaluation link. And with that, I am pleased to introduce our speaker, Dr. Crystal Baumann, who is the Director of Nursing and Allied Health at Oregon Coast Community College, where she oversees the medical assisting, nursing assisting, and EMT programs. And prior to transitioning to her role at the college, she served as the hospital educator at Samaritan North Lincoln Hospital, where she was the co-author for a Geriatric Emergency Department accreditation application. Dr. Bowman's clinical background is focused on the care of older adults, both in the emergency department and intensive care setting. And I will go ahead and turn it over to you, Dr. Bowman.
Thank you, Sarah. We can go ahead and advance the slides. Just making sure that you can hear me okay.
Yes, you sound great.
Okay, thank you. Yes, so it's an honor to be here. Like Sarah said, I was the co-author of this accreditation application, and it was quite some time ago. And this presentation was originally supposed to be presented at a conference, and then of course COVID, and everything had to be changed around. So this work relates to an application for the Geriatric Emergency Department accreditation for Samaritan North Lincoln Hospital. The application was filed early in 2019, and then Samaritan North Lincoln was awarded the level 3 or bronze accreditation on May 22nd of 2019. And they were the first hospital in Oregon to earn this accreditation. Since that time, 2 others have, but it was definitely an honor to be awarded this first and to be part of it. Next slide, please. So like Sarah said, I'm currently the Director of Nursing and Allied Health at Oregon Coast Community College. My previous job prior to transitioning to the college 1.5 years ago was as the hospital educator at the hospital, where I was there for about 2 years. My clinical background is in the emergency department and in the ICU. My very first job as a new graduate nurse, too many years ago to mention, was in an emergency department in Sun City, Arizona. It was known as the geriatric or older adult emergency room in Arizona. The average age of the population was 77 years old. So as a new grad, new baby nurse, I really gained a great love for the older adult population and the special care and consideration that they required. As a disclaimer, I'm no longer with Samaritan North Lincoln, like I stated, and I was the co-author of this. My colleague, Rick Roten, and I wrote this application, and I'm not sure if he plans to attend, but definitely credit goes to him as well for his assistance with authoring the application. I wanted to also add that since this is my area of expertise, I looked for other ways to apply this expertise, and recently was appointed to the Governor's Commission on Senior Services. So it really is a passion area for me to talk about the older adult population, how we can improve care for them, and to really help facilitate that. I didn't reinvent the wheel when I was writing this presentation. I simply utilized resources that are extremely valuable if you are considering starting an application for accreditation. And I did provide links to both the Geriatric Emergency Department accreditation criteria and the guidelines in this presentation if you need them. Next slide, please. But like the saying goes, it definitely takes a village to accomplish something like this. So I wanted to call out some additional important stakeholders. And I'm not certain, I can't currently see the participants, so I'm not currently sure if any of these individuals are attending. And there are certainly many, many more people that I didn't list on this slide. Credit itself goes to all of Samaritan North Lincoln. Anyone that participated in this application is certainly considered to be valuable, and anyone that lives the principles defined in the application and accreditation certainly are valuable as well. But Dr. Leslie Ogden, she is the CEO for Samaritan North Lincoln Hospital and Samaritan Pacific Communities Hospital, and certainly was a huge driving force in the desire to be accredited in this area. Dr. Erling Oxenholt, he is the physician or provider champion for this accreditation. That is one of the requirements, and we'll talk about that a little bit more coming up. He has a specialization in caring for the older adult, and also worth mentioning how extremely honorable it is to have worked with him on this. He is also just named the Rural Health Hero of the Year. Dr. Steve Andiscavage is the current Emergency Department Medical Director at Samaritan North Lincoln. And Casey Lamp, she is the current manager at Samaritan North Lincoln in the Emergency Department. And I believe she intended to be present because I can only speak for the application process itself. I can't speak for the current state or what the future plans are regarding this application or this accreditation. Next slide, please. The objectives of this presentation is to provide information related to the importance of Geriatric Emergency Department accreditation to patients, the hospital, and the community, to familiarize you with the 3 specific levels of Geriatric Emergency Department accreditation, and to introduce and discuss the requirements and processes related to level 3 Geriatric Emergency Department accreditation. That is the one that I know best, and that's the one that I helped to author. So that's the one that I'm presenting. I know a little bit about the differences in the levels and can speak to that as we progress as well. Next slide, please. So before talking about GEDA is what I'll refer to it from here on out versus saying Geriatric Emergency Department accreditation a million times, it's important just to look at the statistical data. Next slide. So according to the state's Office of Economic Analysis, so this is specific to Oregon, populations around the world are now living longer than they ever have before. In the United States alone, it's estimated that 10,000 baby boomers will turn 65 every day. About 1.5 million of Oregon's residents are 50 or older, and that equates to nearly 37% of people living in the state of Oregon. The number of Oregonians age 65 and older will swell to over 1 million by 2030, with seniors comprising 21% of the population. So those statistics alone bring challenges to an already taxed and stressed healthcare system. It's well known and well researched that older adults visit emergency departments more often than non-senior adults. And these patients often present with multiple chronic conditions, and they are also at an increased risk of polypharmacy. And they may often suffer from more complex social and physical challenges than younger adults. As I was preparing for this presentation, this one quote really stuck out to me. So I really wanted to bring attention to the fact that seniors will make contact with the healthcare system at many points, perhaps none as frequently or as importantly as the emergency department. One of my favorite parts about preparing this application for accreditation was this conversation I attended. In preparation for this, I attended some training on how to write it. And one of the speakers, they talked about how traditionally emergency departments are considered to be the front door of the hospital. But considering the entrance to the emergency room for older adults as a front porch makes it more personable and really allows us to focus on the complex care that these patients need. Next slide, please. These are some more statistics that were published by the United States Center for Disease Control and Prevention, National Center for Health Statistics. And really what they speak to is the amount of times that older adults will present to emergency rooms and how they present. It also documents very well that an older adult's interactions with emergency departments increased with age. So if you're looking at the fact that, and these are older statistics, they only went from 2014 to 2017, but current data that I have read show that these statistics have actually increased over time. So looking at emergency department visits alone, the emergency department visit rate was 43 visits per 100 people aged 60 and older. And then as it stated, this does increase with age, as does the number of emergency department visits by residents that are in nursing homes, and the number of older adults that are brought to the emergency department by ambulance. And then an important part of this as well is looking at what happens to the older adult once they present to emergency department, whether they're able to return to wherever they came from or whether they need some type of transition of care addressed. So the GEDA, it addresses that as well. Next slide, please. So the question becomes why there should be such focus on geriatric emergency departments, and we'll talk about that next. Next slide. The concept of geriatric emergency departments isn't a new one. It's been evolving over the past decade. And it's really evolved because hospitals began to recognize that one size doesn't fit all when it comes to care provided to older adults within an emergency room. And it simply comes down to the care that a 79-year-old needs may be very different than the care that a 29-year-old needs, and it has to be customized and individualized. Older adults have presentations, needs, complex histories, complex problems, and have outcomes that are extremely specific and require specific education and training. A geriatric ED can be an entirely separate space designated for older adults, or it can also be in an emergency department that has integrated best practices for older adults. And this was the case at Samaritan North Lincoln. That is what we did, is integrated best practices into the existing department. Next slide, please. Geriatric emergency departments address a variety of best practices. That's one of the things that are accomplished by the application and by the journey through application and eventual accreditation. So just some of those best practices include ensuring that geriatric-focused education and interdisciplinary staffing occurs, providing standardized approaches to care that address common geriatric issues and complexities, focusing on those optimal transitions. So maybe once the older adult presents to the ER, they might need to go to residential care, or they might need to go to rehabilitation, or maybe they need to be inpatient. And one of the best practices is really focusing on how to make that transition as seamless as possible. And the final one is promoting geriatric-focused quality improvement and enhancements of the physical environment and supplies that can be found within these emergency departments. And this is also addressed in just a little bit. Next slide. So what is the importance of receiving geriatric emergency department accreditation? In general, it improves the care that's provided to older adults within your community. It ensures that specific resources are available to provide care to older adults. And it truly does signal to the public that your hospital or your institution is focused on the highest standards of care for the older adults that reside in your community. Next slide, please. This has become such an important accreditation, such an important standard that 4 national geriatric and emergency medicine organizations joined together to collaborate and develop and endorse geriatric guidelines that outline recommendations for optimal care within any emergency department caring for a geriatric patient. The first one that's listed is ACEP, or American College of Emergency Physicians. This entity is the one that actually does the accreditation and approves it. Next slide, please. GEDAs can provide value to patients and hospitals, as well as the community. So I really just put patients and the community within the same context, because these older adult patients do reside within your communities, or maybe reside within communities part of the year or part-time, but still seek out care in your hospitals. Next slide. So there's several valuable aspects of GEDA to patients. The first one is that being accredited as a geriatric emergency department, it provides clearly defined, measurable criteria that is standardized to improve the quality of care that's provided to older adult patients. Whoever is accredited, it's published on a website. So patients and families can look at this website and determine what hospitals or organizations are accredited, and they can choose to go to those facilities. So they have the ability to make informed decisions about their care and be protected from misleading claims that someone is a geriatric emergency department that's accredited when really they might not be. As a GEDA, there is greater transparency regarding services that are provided within emergency departments. More screening occurs for geriatric syndromes within these emergency departments. It's part of the process is to explain and provide documentation of the processes that are employed. And overall, it just generally improves the care that older adults with complex conditions receive. Next slide, please. Obtaining this accreditation is also extremely valuable to hospitals. The structure of the program itself is extremely flexible, and it's feasible for large or small hospitals. As an example, Samaritan North Lincoln is a critical access hospital. So we were able to write this application and be successfully accredited with just a small investment by just really taking a look at what we were already doing. The cost for converting a standard treatment room to a geriatric room is about $1,500 or less. And it really depends on the resources and the staffing that you already have available within your hospital and within your department. And some studies have been done on geriatric emergency departments that are accredited. And what has been found is that these EDs have lower admission rate and lower readmission rate. So overall, being a GEDA can actually reduce cost. Next slide. So some things to consider prior to beginning the accreditation process. The first step is to really distinguish between the various levels of GEDA and figure out what your priorities are. What are your highest priorities? What are your lowest priorities? And what you can really accomplish in terms of being able to justify what you're doing within emergency departments that would qualify. Establishing distinctions between sites that exhibit the highest level of senior-friendly care is also important. And there are 3 main levels that you can become accredited at. And these levels were established by this group of physicians that came together to determine what each level should look like and what would be required at each level. And we are going to review each level from a very high level, just to review what's necessary for each of them prior to considering application. Next slide, please. So regardless of what level of accreditation you are considering applying for, they look at 7 main criteria. So those various domains is what they're called within the application is staffing, education, policies, protocols, guidelines, and procedures. Those are all lumped into one category. Quality improvement, outcome measures, equipment and supplies, and the actual physical environment. What distinguishes one level from another is how much verification and documentation you have to provide. So for level 3, we had to pick out 2 policies that applied to what they were requesting, whereas a level 1 may have to supply 10 policies. So the standard just increases as the level increases. Next slide, please. So level 1 is the highest level of accreditation. And this accreditation supports sites that have numerous policies, guidelines, procedures, and staff providing a coherent system of care that target and measure specific ED outcomes for older adults. That's really the key with the level 1. You'll see as we talk about level 3 in a few minutes, outcomes aren't really stressed during level 3, but they are stressed more in level 1 and level 2. For level 1 accreditation, the policies, guidelines, procedure, and staffing models must elevate the operation of the emergency department, as well as truly focus on those transitions of care, both to and from the emergency department. All of the policies, guidelines, and procedures must be coordinated to specifically improve care of the older adult and not just be applied generically to the entire hospital population. Additionally, there are numerous physical plant enhancements that have to be made or documented or verified that relate to physical environment and equipment that is available. Next slide, please. So level 2, it supports sites that have integrated and sustained older adult care initiatives into their everyday daily operations. These sites demonstrate interdisciplinary cooperation for delivery of senior-friendly services and care, and they have an established and documented supervisor or director that assists in the day-to-day coordination of staff that are tasked to deliver care and resources to the older adult. Next slide. And then finally, level 3, this is the one that was awarded to Samaritan North Lincoln. Accreditation at this level signifies excellence in older adult care as represented by one or more geriatric specific initiatives that are reasonably expected to elevate the level of elder care in one or more specific areas. And as we progress through level 3, I'll talk about the specific areas that we focused on when writing our application. Additionally, there must be specific personnel available to implement any efforts that were identified, and training must occur related to any effort that was identified and implemented. Next slide, please. So the next portion of my presentation relates to the requirements for level 3, as well as just a little bit of process information. Next slide, please. So level 3, I mentioned before, you won't see outcome measurements listed here because level 3 represents the basic standard of care that every single emergency department should provide, and it focuses on 6 of the 7 specific domains. So when writing an application for level 3, we had to justify staffing, education, policies and protocols, quality improvement, equipment and supplies, and the physical environment. And there are slides for each of these areas coming up to give you more specific information. Next slide, please. So the first area is staffing. So for level 3 accreditation, it specifically states that the institution must ensure the availability of at least one emergency medicine boarded physician who is on staff and who can provide evidence of some focused emergency department education that is specifically relevant to the care of the older adult. In our case, this was Dr. Oxenholt, and I'll talk a little bit more about the education that he acquired and had to verify when we discuss education in the next slide. The institution must also ensure availability of at least one registered nurse who can provide evidence of some focused emergency nursing education specifically relevant to the provision of care to the older adult within the emergency department. Next slide, please. So moving on to education, I broke this apart into 2 different categories. The first one is the provider and the second one is the nurse. So with regard to provider education, like I stated, there had to be a physician champion or a medical director that had some extensive training and background in the care of the older adult. They had to demonstrate this focused training through providing a variety of transcripts and continuing education credits. This training could be demonstrated through coursework that focused on geriatric specific syndromes and concepts. It could be focused on clinical issues that are somewhat exclusive to the geriatric emergency department patient, or it could be related to the discussion of issues common to all ED patients, but focused on the unique factors that are found in older adults. So what that truly means is if a physician had taken a course on strokes, just strokes in general, it wouldn't apply unless there was a specific part of the training that related to older adults in specifically. So that it had to be some distinct education. Next slide, please. So any physician champion or medical director that was willing to lead a level 3 geriatric ED had to represent through certificate or continuing education at least 4 hours of education that was specifically related to the older adult. And that education had to cover all of the 8 domains of geriatric emergency medicine. And those domains are the atypical presentation of disease in older adults, trauma, including falls, cognitive and behavioral disorders, emergency intervention modifications, medication management, specifically related to polypharmacy, transitions of care from the ED and to the ED, the effect of comorbid conditions or polymorbidity, and end-of-life care. Next slide, please. From a nursing standpoint, education had to be verified for at least one registered nurse that was assigned to the emergency department, and documentation had to include specific information about care provided to the older adult. So GEDA provides you with some specific places where you can obtain this education for your nursing staff. One of the most popular ones is the Genie courses that are sponsored by the Emergency Nurses Association. Another one is some modules that are published by NISH, and that stands for Nursing Improving Care for Health System Elders. The issue with this one, I found when doing the application, was that your organization or facility had to be associated with them in order to access their modules. So you had to have a subscription and be able to sponsor or pay for staff to take these modules. The most recognized and perhaps the simplest way for nursing staff to acquire their education was through locally developed nursing education modules. So maybe perhaps through professional development. That is how our nurses at Samaritan North Lincoln were able to acquire theirs, was through some modules that were assigned to them that they were able to complete. Next slide, please. So policies, protocols, guidelines, and procedures, they lump these all together. And what they ask is that sites applying for level 3 accreditation provide evidence of at least one geriatric specific emergency care initiative. So some examples might be elder mistreatment, cognitive impairment. What the major thing to remember with this is that it can't be a hospital-wide policy that you submit when you're applying. It can be, but you have to revise it to add a section that specifically relates to the care of older adults. So hospital-wide policies, if you're submitting them as documentation, you must be prepared to provide a detailed explanation of how you apply that policy to older adults. Any protocols that you submit for consideration must specifically address the needs of the older adult population. And they really are looking for policies and protocols that address the implementation of the policy and how it's tracked with regard to training, education, adherence, and then quality management as well. Next slide, please. So I just provided you with some examples of some potential policies and protocols that you might consider submitting. So you could potentially look at a process for screening all older patients for delirium. You could look at a potential process for identifying functional deficits in older adults. Maybe you want to look at falls as a potential area to assess or implement a policy regarding fall prevention of the older adult within specifically an emergency department. You may want to look at a policy around transitions of care or possibly around medication reconciliation for the older adult. And this is just 5. Somewhere at one point I found a list of like 40. And then that's how we began our search at Samaritan North Lincoln. We started looking at all of the policies and procedures that may apply to older adults and found a couple that we really liked that were more hospital-wide. And we ended up revising those policies to specifically address the needs of the older adult within the emergency department. Next slide, please. So quality improvement is another important aspect of a level 3 application. Level 3 GEDAs do not necessarily need to have an official quality improvement program within their geriatric emergency department. What they really are looking for is implementation and education tracking And this also includes a plan to make sure that people are adhering to whatever policies and procedures related to the older adult are administered within the emergency department. You are asked to provide a description of how the emergency department ensures that programs will be implemented, adhered to, and maintained. And at the beginning, they're very honest that they're not looking for 100% compliance, but what they are looking for is dedication to implement and aim toward continuous quality improvement in your plan. So as long as you have that, they will likely approve this section of your application. Next section, please. So for a level 3 GEDA, the specific focus on equipment and supplies, it strictly called out that you must have access to mobility aids for 24/7 use within the emergency department. So things like 4-point walkers and canes, they had to be available within the emergency department itself. It was not enough to say, I'll write you a prescription and you can go pick this up somewhere, or we're going to have this device delivered to your home. They had to be physically available to the patient to take home with them if they were discharged from the ER or transitioned elsewhere. Some other equipment that's specifically called out within the application relate to non-slip socks, pressure reducing mattresses, blanket warmers, hearing assistant devices, bedside commodes, condom catheters, transitional devices from bed to chair, lower beds, and reclining armchairs. Next slide, please. And then the next criteria was physical environment. And what the application states you must provide verification of for a level 3 GEDA was easy access to nutritious food and beverages. And there's a disclaimer that you must provide documentation of how that access is available 24 hours a day, 7 days a week. And they really focused on nutritious food. So it's not enough to be able to say to a family member, there's a vending machine around the corner, you can go get food there, or there's a cafeteria down the hall, you can go get food there. It has to be accessible all the time. Some other aspects of physical environment that are mentioned are the availability of 2 chairs within an emergency department room to facilitate family participation and visiting, as well as for the physician to be able to sit down when they are talking to the patient. A large analog face clock was mentioned, enhanced lighting, efforts to reduce noise, a non-slip or non-skid floor, adequate handrails within the room and within the hospital itself, high quality signage or wayfinding abilities, wheelchair access to toilets, and raised toilet seats. Those are all things that they ask for documentation and verification of. Next slide, please. So like I mentioned, in a level 3 GEDA, you are not required to provide any type of outcome measurement data or proposals, but it is important to consider as you apply what outcomes you're truly wanting to measure with this accreditation. So do you want to look at things like length of stay for an older adult, or do you want to look at readmission rate? Do you want to look at potential falls being the cause of older adults coming to your emergency room and the treatment that they receive? So it really is tailored to what you want to look at. Next slide, please. So just a little bit about Samaritan North Lincoln's pathway to level 3 accreditation. Writing the application itself is fairly easy. You do every single thing online. So if I can offer just some advice for consideration, When Rick and I were writing the application, we wrote everything into Word documents and we saved the Word document individually. And then when we submitted the application, we would copy it. We copied and pasted the documentation into the boxes that they provide, but we also sent the Word documents as an additional layer of documentation. We submitted the application the first time and received it back about a month later. They were asking for additional documentation. So what we originally submitted was copies of the policy that specifically focused on the care of the older adult. We submitted pictures. That's one of the requirements. You have to submit pictures of where your equipment is kept so that you can prove that it's accessible to patients and staff. We had to send pictures of our food area within the emergency department to show that we had a refrigerator. We had to take pictures of the inside of the refrigerator to show that there was a variety of food available within the refrigerator. And then we really just had to write up specific plans of what we were doing, how we plan to uphold this accreditation. We had to submit all of Dr. Oxenholt's training and education transcripts, as well as that of the nurse that was the representative at the time. So during the process, what went well was the application process itself. One of the things that we realized right away was that we were truly prepared to submit this application and to be accredited, and that we were already providing really, really great care to the older adult population. Some opportunities for improvement that were discovered when this was very first started, the mobility aids were kept more in an emergency department storeroom and weren't as accessible as they possibly should have been in the beginning. That was one of the things that they came back and asked of us, is to move that. So and when we got accredited, it was in our old hospital, not in the new hospital that currently exists. So there was a little kind of entryway area, and that's where we moved the mobility aids, took pictures of that, and then they were completely satisfied with that when we resubmitted. We also learned a lot about the accessibility and availability of nutritious food. In the beginning, we thought that it was enough to say the cafeteria is right down the hallway. If a person needs food, we will just go get it. But that wasn't enough. We had to actually provide documentation of it being available within the department, and that there was a wide variety of food, specifically if patients were on specific diets, like a low sodium diet or whatnot. For next steps, I cannot speak to that, and I can't really see the participants to know if Casey is here or if Dr. Ogden is here to talk about next steps. I know that a potential next step for the hospital would be for them to apply to a higher level of accreditation, and then obviously to recertify when it's time. I'm not sure who's present.
I don't see their names, but there are
Okay.
two call-in users
Okay.
who don't have names associated with them. So if Dr. Ogden or I'm sorry, I forgot.
Casey.
Casey, yes, thank you, are on the line, please feel free to unmute.
Yes. Next slide, please. Is any questions that anyone might have for me related to this process in general or accreditation in general?
Thank you so much. I have a couple of questions. In terms of the accreditation process and maintaining that accreditation, is there some sort of survey process that you need to go through on a regular basis for maintenance? And how does that look?
Not that I'm aware of, and that may have changed. A lot of things changed too over time. One luxury of this accreditation was that we were able to submit everything electronically. And then we did hear a little bit like, well, it's possible that the accreditors might make a site visit just to verify and validate the documentation and the location of your equipment and supplies. But then COVID came. So I don't believe that they've ever been out there, but it's always a potential that these types of accreditation visits could be in person, just like other accrediting or regulatory bodies do.
Great, thank you. We had another question come in. What happens if your champion, so a physician, nurse, leave the organization?
That's a great question. You would have to identify another champion and then update the accrediting panel as soon as possible. On the website, when you go to apply, when you apply for accreditation, you get your own login. And that's where you do the application. That's where they'll post to you if you need any more information. That's also where they'll say, congratulations, you're accredited. And that's also where you can post any updates. And there's also specific email addresses that you can email ASAP any updates such as that.
Great, thank you. So besides lessening the costs of healthcare kind of more in general among the older adult population, are there financial benefits to the hospital for getting Geriatric Emergency Department accreditation?
I think that would be a great question for Dr. Ogden or even Dr. Oxenhold if he came. But what I do know of it was of the historical perspective of it is the financial benefit comes with the more confidence that people have in your ability to care for their loved ones. So especially in small communities like ours, there's sometimes the potential for someone to say, well, I'm not sure if a small hospital could take care of our older adult loved one in a specific way. So being accredited and having that gold standard behind you, it definitely lends confidence in your ability to provide that care. So of course, then more visits equate to more money coming into a hospital system. So I can make that statement, but I can't really speak to the reasons why Samaritan North Lincoln wanted to apply in the first place. I was just honored to be part of the process from the beginning.
Absolutely. And it looks like we do have Casey on the webinar. There are, excuse me, two folks who are phone numbers only that I will try to unmute so she can speak. But in the meantime, I do have another question to address as we work on that portion. So that question is, what kind of new strategies did Samaritan North Lincoln employ over time to receive the Geriatric Emergency Department accreditation? Or even what you learned after becoming
Yeah,
accredited?
yeah. So one amazing thing that happened shortly after accreditation is that and if you want to advance one more slide, I think that's going to help too. Casey's contact information is on here too, just in case she can't talk. So with regard to improvements or things that were learned, shortly after we were granted accreditation at the hospital moved into a brand new state-of-the-art facility. The emergency department is state of the art and it has a lot of new technology advances built into it that specifically support the older adult. One of the major factors in this ER is that every single room, as well as the ambulance bay, as well as all of the inpatient rooms, have a lift in them. So for those older adults that have trouble transitioning from place to place, this was definitely a very, very nice addition. And then the ED itself is full of of different advances that will definitely lend itself well if they decide to apply for a higher level.
Great, thank you. And I have unmuted the two callers. Casey, if you're on the phone, would you please say hello?
Hello, can you hear me now?
There she is.
We can.
Yay! Hi, I'm Casey Lamp. I just took over for Rick Roten at the Emergency Department in North Lincoln. I am super happy and honored to get to listen to this presentation and learn so much about this accreditation. I think it's a fantastic accreditation, and I think our geriatric population definitely deserves some extra attention and care when they come into the emergency department. So my goal is to hopefully get with Crystal and learn a little bit more about what her and Rick did and the process that they took, and then maybe talk to Denise and work to be a level 2 if that's something North Lincoln can accommodate.
That's great. You know, I know that at level 3, there are no quality improvement measures that need to be tracked, right? But is that true that at level 2 and at level 1, that becomes the case?
Yes.
And in
Yeah.
those cases, then, you know, how much more work on top of the quality improvement measures that are already being tracked is that, or is it kind of incorporated into what is already being measured?
I think you could look at it both ways. If a hospital already has a quality department, which North Lincoln does have a quality department, then if the decision is to move on to a higher level of accreditation, then a lot of the quality improvement measures that they're already tracking would apply. They would have to just add on perhaps an extra metric that specifically measures the older adult population. So they could incorporate what they're already doing with to get accredited at that higher level, but just looking at it a little bit different. Or they could add on older adult specific ones as well.
Great. And we have one last question here. Someone wondering what the cost is for accreditation.
That is an excellent question, and I have no idea. So I'm sure that we can find out for you. I know that I think it's different based on the level that you're applying for, but I honestly never knew the cost. I just helped write the application.
Great. If you figure that out in the next couple of days, I'm happy to send it in the email with the link to the presentation and the slides too.
Yeah, sure. I'm sure that either Casey or I could ask Dr. Ogden, and then I can forward you on that information. I did, this is the final slide, and I just wanted to specifically provide Casey's contact information. I am not there anymore, probably wouldn't be involved in any recertification process or higher level of accreditation process, but Casey is. So if you have questions related to whatever the current status of Samaritan North Lincoln's accreditation is, or any future plans, then please reach out to her. If you have any questions about the process itself, or want me to clarify anything I talked about any further, or even want advice if you're starting an application journey, then I'm happy to help you with that. So both of our contact emails are provided for you.
That's terrific. Thank you. And thanks so much for a really great presentation, Crystal. We really appreciate it. And I want to draw folks' attention to the chat. I have put the survey link for this session in the chat. In addition to getting your general feedback, we ask that you complete that if you would like to get CE. So this is our last session for the 2021 Virtual Forum on Aging in Rural Oregon. And we really thank you for your participation and hope you'll join us in Seaside in May for an in-person event. So be on the lookout for details on that soon. All right, and with that, I will close us out. Thank you again. Really appreciate it.
Thank you all for attending. I appreciate it.
Thank you, Crystal. Beautiful presentation.
Thank you.